It's been a long morning, Heidi, and I don't know if any of the people who arrived there earlier have now been attended to. I saw one of your crossings earlier this morning, somebody saying they've been there since 6:30. They had not yet been attended to.
Yes, certainly, Brother, and I think there's definitely been an influx of support staff, health support staff here at this vaccination centre here in Johannesburg. But we've also managed to figure out that those who were only expected to get vaccinated in phase 2 have actually arrived at this vaccination centre. And I think to get into more detail with regard to this, we are joined by Mia Milan. Thanks so much for your time, Mia. I think firstly, if we can just talk about the fact that we are seeing people above the age of 60 getting vaccinated when that process is only supposed to begin on the 17th of May.
Yes, that obviously raises huge concerns because, first of all, the Sisonke study is a study for healthcare workers, not for people over 60 who are not healthcare workers. So that raises questions around what kind of input is there in the study. Secondly, the Sisonke study is vaccinating 500,000 healthcare workers, and we haven't done all of those yet. Yesterday, the figures were just below 400,000, and it's very important that we go in the phases that the government has announced. There's a reason for those phases. It's about who's most vulnerable. And the reason that healthcare workers are getting vaccinated first is because they're the most likely to be exposed to the virus. So our phase 2 is only starting on Monday. And if people jump the queue now already, it raises a bigger question about how will people be prevented from jumping the queue generally when the mass rollout starts. What processes are in place, and why would vaccinators accept people who are not part of a certain phase?
Certainly, I think it does raise a lot of questions and concerns. But let's move into the fact that we are expected to start phase 2 on Monday. But there's been a lot of anxiety and reluctance to get the vaccine, or for those above the age of 60 to even register. Speak to us about whether or not you think the deadline set out by the Department of Health will actually be met. Will we be able to vaccinate healthcare workers on time, and will phase 2 go according to the deadline set?
So to answer that question, we need to look at what have we got that is available. And if we look at what do we know that we have one batch of Pfizer vaccines, just over 300,000, to vaccinate people. And we know that the health minister said in an interview on Sunday on ENCA that the verification process for quality has been completed for that batch, and they will start to distribute it to provinces tomorrow and the rest of the week, so that all the provinces where there will be sites will have these vaccines by the 15th. So I think we can be relatively sure that there will be some vaccines that we could start with. We also know that the health minister said that a second batch of vaccines was going to arrive on Sunday night, just before midnight, but we haven't had official confirmation that it has landed. We just hope that it has landed. Then we know that there are J&J vaccines waiting for us at the Aspen Eastern Cape plant, but that they cannot be released yet because there's the international verification precautionary process underway by international regulators, and no J&J vaccines can be released around the world before that process is not completed. So we don't know when it will be released, and I don't think that's the health department's fault. We really have to wait for this process to be concluded. But what we do know is that when those vaccines get released at the Eastern Cape plant, they're not going to be distributed to provinces from there. They're going to be flown to OR Tambo, and from there they're going to be going into quarantine, and samples will go to the Bloemfontein lab to test for quality. And that process normally takes 5 to 7 days. So there's not a lot of time left for those J&J vaccines to be released and to be verified for quality and to reach sites in time. So from that, I would think that we're probably going to start with Pfizer, and we know that Pfizer vaccines will be used in urban sites because of the storage requirements, and J&J in rural sites. So we most likely, I would imagine, to be starting off with urban sites.
Interesting insights there. And then just lastly, I wish we had more time, but just speak to us with regards to the fact that we are waiting for J&J to be released, and all of those processes to be concluded, what that means for the fact that we in the country currently only have Pfizer, what that's going to mean for the overall rollout process. Already there's been so much panic and criticism towards government for the fact that this vaccine rollout has been extremely slow. If you look at global numbers, if you look at numbers just in Africa, everybody is leaps and bounds ahead of us, and it just seems as though we are moving at a very slow pace. If you just look at this vaccination centre alone, they can't even do over 1,000 jabs per day. So what does this tell us moving forward?
Well, what we know about Pfizer is that we need 2 shots compared to 1 shot of J&J. So obviously that process is slightly more complex, and it also, because it means you need to get someone back to the vaccination centre to come and get their 2nd shot. Otherwise, the vaccine is not as effective as it should be. We also know that, as I've mentioned, it will be used at urban sites. So we may not, or unless there is a way that they find to use those Pfizer vaccines at rural sites, we may see more urban sites opening initially. I think a lot of the anxiety that has been created relates to inconsistent communication of the health department. I do think they are working very hard, and I do think there are many people caring in that department. But what is lacking is consistent communication. For instance, people have registered on the EVDS, people above 60, but no one knows when their SMS is going to come with a date or the place where they're going to get vaccinated. And that creates anxiety, and people start to make up their own theories about it, which could be, outrageous, sort of like beliefs that they have around why is this happening. So I really think the health department needs to think about having consistent communication and tell us when they don't know when something is going to happen, so that we know why it's not going to happen, and that anxiety is brought under control.
Fantastic. Thanks so much for your time here. We really do appreciate it. I wish we had more time, Bradan, but of course it just speaks to the uncertainty and the lack of communication that many people are experiencing with regards to when it's their turn to get the jab. And then you have a situation where people are already arriving at vaccination centres, specifically this one, I'm not sure about others, when they're only supposed to be here on Monday, but they are getting their jab. So what does this mean? What is the further implication of that happening? Is there an implication thereof? So we'll have to just figure out what exactly that means, and whether or not phase 2 will officially begin on Monday.
Yeah, there's going to be a lot of confusion because many people who've registered online for phase 2 are still waiting for their SMSs to tell them when they will be getting their jab from next week and where. But now some of them have jumped the queue. It's going to be interesting how the health department is going to have to deal with that one. Thank you very much, Heidi Jokos.